Hello, everyone. Welcome back to the Organon Classroom with Dr. Gazala. Here we are with episode 5 of our Hughes series, Lecture 6 Similia Similibus. In the last two lectures of this series, we have covered exceptionally well the concept of disease and medicines. Today, we are going to cover the third part, which is included in the ground plan of Organon, that is, the curative action of medicines. And hence, we are going to understand what exactly Hahnemann meant by the term cure. Okay, so in today's lecture, we are going to trace the historical evolution of this principle, learning and understanding how the true action of medicine becomes the cornerstone in homeopathic therapeutics is going to be an exciting journey. Let's begin with the lecture for today, Similia Similibus. Now that we clearly understand the history behind drug provings, we are ready to understand the gist of homeopathy, Similia Similibus Curentur, the inclusions, the exclusions. We have already covered in detail in our special topic lecture, Curentur versus Curanter, the philosophical part of it. Today, we are going to see the practical part of it. Okay, so this principle rests on two essential elements. As you can see, there are the two pillars of this cure. The first pillar is the phenomena and sensations of disease. ठीक है, अब इसका मतलब क्या है that every patient is going to experience and express something as symptoms. Okay, and the second pillar is the drug action, that is the effects of the drugs on the healthy individual. So what is this drug effects of the drug on healthy individual? It is the drug proving part of it. ठीक है, neither of these elements alone can cure. ठीक है, a patient's symptoms without the knowledge of medicines leaves us guessing. Obvious सी बात है, knowledge of medicines without understanding the patient is equally useless. क्यों? क्योंकि अगर भाई तुम ड्रग प्रूविंग करते जा रहे हो करते जा रहे हो करते जा रहे हो, बट वो ड्रग को आप इंसानों में, इंसानों के अंदर वो पोर्ट्रेट बना के उसको मैच ही नहीं कर पा रहे हो, then what is the use of your drug provings and all of it? Why are you proving the drugs? Why? The question remains unanswered, right? Similarly, if you are having your disease part of it, ठीक है, and you're just keeping on recording and recording, अरे ये पेशेंट आया है, इसमें इसका डायग्नोसिस था, इसको ऐसे हो गया, ये टाइफॉइड में ऐसा हो गया, ये इसका जो मलेरियल फीवर था इसमें ऐसा हो गया, नाउ यू गॉट सो मेनी फीवर्स टुगेदर. ठीक है, चाहे उसमें डेंगू वगैरह हो जाए, चिकनगुनिया और वॉट एवर, ऑल सॉर्ट्स ऑफ फीवर्स यू गॉट ऑन योर 300 पेज बुकलेट. Okay, but uska kya, what are you going to do of it? What medicines are you going to prescribe? एक्शन ऑफ मेडिसिन आप कैसे डिसाइड करोगे? तो जब तक आप ड्रग प्रूविंग नहीं पढ़ रहे हो, जब तक आपके पास में ऑलरेडी रिकॉर्डेड सिम्टम्स नहीं है ऑफ द ड्रग which had its effect on the healthy human being, so you cannot really cure that patient, right? You're just making that patient worse. उसकी हिस्ट्री ले लेकर, अरे हिस्ट्री लेके भाई यू अंडरस्टैंड द प्रोसेस, और ये जो प्रोसेस जो अपने को अंडरस्टैंड करना है ना, वो ही हम इस लेक्चर में कवर करने वाले हैं. ठीक है, बिकॉज आगे का लेक्चर इज गोइंग टू बी सिलेक्शन ऑफ रेमेडी, दैट इज गोइंग टू मेक आवर वर्क वे इजियर. ठीक है, तो आज जो हम पढ़ेंगे इज गोइंग टू बी द एक्शन ऑफ आर मेडिसिन. व्हाट इज क्यूरेटिव इन दैट मेडिसिन? अपने को मालूम है कि सिंकोना है, मलेरियल एग ठीक कर देगा तो कर देगा, बट वो कैसे कर रहा है और वो क्यों कर रहा है इज व्हाट वी आर गोइंग टू स्टडी इन टुडेज लेक्चर. ठीक है, सो बिफोर वी कैन अप्लाई दीज लॉ ऑफ सिमिलर्स एंड ऑल, वी मस्ट फर्स्ट अंडरस्टैंड दिस वन इंपॉर्टेंट क्वेश्चन जो अभी हम बात कर रहे हैं. How exactly do drugs act on the human body? Okay, then that is what we are going to explore next. Hughes has explained wonderfully the modes of actions as mechanical and chemical action. ठीक है, तो अभी ये जो ड्रग है ये अपनी ह्यूमन बॉडी में किस तरीके से एक्ट होगा? दो वे से एक्ट होगा, एक मैकेनिकल एक्शन से और एक केमिकल एक्शन से. ठीक है, अभी मैकेनिकल एक्शन we'll study one by one. Okay, तो अभी पहले लेफ्ट साइड. So mechanical action is usually physical, it's purely physical. Why? Because the medicine acts by its bulk or weight. ठीक है, मैकेनिकल मैकेनिक्स, ठीक है, वेट वॉल्यूम वगैरह ये सारी चीजें उसमें आ जाएगी, नॉट बिकॉज ऑफ एनी स्पेसिफिक मेडिसिनल प्रॉपर्टी. ओके, फॉर एग्जाम्पल Crude mercury was once swallowed to push an intestinal obstruction, and olive oil was used to help biliary stones slip out. इसमें कुछ वो एक्शन ऑन दैट थिंग नहीं कर रहा है, इट इज जस्ट क्लियरिंग इट ऑफ इट्स वे. ठीक है, जैसे अपन ने टोले कॉजम पढ़ा था, याद है? तो टोले कॉजम क्या था? रिमूवल ऑफ द कॉज टाइप था. अब ये कॉज को पुश करने के लिए हम जो मैकेनिक्स यूज करें, सो दैट इज कॉल्ड एज सिंपल मैकेनिकल एक्शन. हियर द इफेक्ट इज फिजिकल rather than pharmacological. सिंपल, नो रॉकेट साइंस. ओके, अब आते हैं राइट साइड पे, द केमिकल एक्शन. Chemical action is different from mechanical. Obviously, why? Because the drug is reacting chemically with the substance already present in the body. ठीक है, तो ह्यूजेस अपने को क्या बोलता है कि an alkali neutralizes excess stomach acid. Obvious. Piperazine helps dissolve uric acid, and potash salts are historically used where excess lactic acid was believed to play a role. अबे ये केसेस में क्या हो रहा है? The medicine behaves like a chemical reagent. ठीक है, इन द टेस्ट ट्यूब प्रोड्यूसिंग अ प्रेडिक्टेबल केमिकल रिएक्शन. ठीक है, जैसे अपन स्कूल में केमिस्ट्री वगैरह में पढ़ते थे कि इस केमिकल को इससे मिलाओ, केमिकल ए केमिकल बी इज गोइंग टू गिव यू केमिकल सी और समथिंग ऑफ दैट सॉर्ट. फिर उसके बीच में कैटलिस्ट आ जाता है, फिर उसके बीच में इफ यू आर यूजिंग समथिंग एल्स, सो दैट एंटर्स एज अनदर केमिकल और अनदर रिएक्टिंग एजेंट और समथिंग ऑफ दैट सॉर्ट, राइट? तो केमिकल क्या है? जब ऑलरेडी कोई चीज बॉडी में प्रेजेंट है और हम कुछ एक चीज ingest कर रहे हैं, which we are giving to the patient, is going to react chemically. Okay, उसका action उस हिसाब से होगा. But then Hughes was also reminding us over here that homeopathy is not based either on mechanical or chemical, as all of us know. अपना action क्या है? अपना action है dynamic action. और वो क्यों है? Because of the ability to influence the living organism. अपना vital force का भाई concept ही dynamism है. ठीक है, अपना कंसेप्ट ही है कि हम डायनामिक है. तो कोई भी चीज अगर डायनामिक है तो उस पे फिजिकल या मैकेनिकल या केमिकल एक्शन काम नहीं करेगा. सिमिलर काइंड का होना बहुत जरूरी है टू इन्फ्लुएंस समथिंग और समवन. इफ टुडे आई एम अ टेडेक्स टॉकर, ओके, आई एम अ टेडेक्स स्पीकर, तो आई एम गोइंग टू बी टॉकिंग टू ह्यूमन बींग्स. ठीक है, ह्यूमन बींग्स भी कैसा? जिनका मैं इंक्लूजन रखूं टू रिलेटेड टू दैट टॉपिक. If today I'm a TEDx speaker, but I am speaking to animals of all kinds except human beings, so you think they are going to get influenced by whatever I'm talking? Am I talking the same language of as this? No. So that is why जब dynamic vital force है और जब वो dynamically derange होके वो dynamic उसका changes होके आपको disease symptoms दिख रहे हैं, तो boss you will have to give some medicine which is going to be dynamic in nature, meaning उसका जो curative action होगा it is going to be in the dynamic plane, and it is going to get that deranged vital force in place. Okay, that is the mode of action that Hughes has reminded us while explaining कि generally medicinal effect mechanical और chemical action से होते हैं. Okay, अब जब हम डायनेमिज्म का कॉन्सेप्ट जानते ही है, वी आर गोइंग टू अंडरस्टैंड अ स्टेप फर्दर इन इट. ठीक है, डायनामिक एक्शन मीन्स दैट द मेडिसिन एक्ट्स ऑन द लिविंग ऑर्गेनिज्म itself, on the body's vital processes, not merely on chemicals or physical structures. Exactly what we told in our last slide, right? तो now example लेंगे हम कि we'll take arnica and calendula. ठीक है, arnica and calendula, they help bruises, injuries, and they heal not by chemically dissolving the damaged tissues but by stimulating the body's own healing process, right? Similarly, osmium fumes can produce eczema even on unbroken skin, showing that medicine can influence the living body without direct physical contact. तो मेडिसिन का वो इफेक्ट लाने के लिए जरूरी नहीं है कि वो मेडिसिन आपको ओरली दी जाए या मेडिसिन आपको फिजिकली लगाई जाए. इवन बाय इनहेलिंग दैट medicinal substance, there can be changes in the body, and you can see that visibly well, right? Same principle explains why arsenic can be used to cure certain cases of eczema. The medicine acts dynamically on the patient's vital force, following the law of Similia Similibus Curentur, right? Hughes emphasizes that the true action of a homeopathic medicine is dynamic. Okay, it works through the living system, not by any chemical or mechanical effect. This dynamic action is the foundation on which our law of therapeutics is based. Okay. Now, there are two exceptions to this rule where our medicine is not going to act dynamically. Instead, it is going to act directly. अब ये दो exceptions क्या है? पहला आता है parasite, second आता है syphilis and organic substances. Now, by syphilis over here, the syphilitic lesion, we are not talking about the product of the disease and all of it. ठीक है, ये हम लोग second part में करेंगे. पहले हम लोग parasites discuss करेंगे. All right. तो जैसे कि एग्जांपल हो गया सैंटोनिन है, इट विल किल द राउंड वर्म, फिलिक्स मास है, इट्स गोइंग टू किल टीनिया. फिर पर्निशियस अनीमिया जब हो जाता है बिकॉज ऑफ द पैरासाइटिक इन्फेस्टेशन फॉर अ लॉन्गर टाइम, उसके लिए ठीक है. मलेरिया में जब हम कॉज को ट्रीट करेंगे विद थाइमोल वर्सेस ट्रीटिंग सिम्प्टोमेटिकली विद आर्सेनिक, तो उसमें यू कैन डिस्टिंग्विश बिटवीन द कॉज एंड द सिम्टम. ठीक है, तो यहाँ पे ये जब होता है वे यू आर एक्टिंग ऑन दैट organism itself rather than the vital force, तो यहाँ पे direct action हो जाता है. ओके, तो जो parasitic conditions है we are acting on the parasites. all right. सेकेंड आता है syphilis and organic substances. ठीक है, अभी syphilis का मतलब क्या है? अभी जब आयोडाइड ऑफ पोटेशियम एक करके है विच इज एडमिनिस्टर्ड फॉर द ग्यूमा. ग्यूमा क्या है? स्पेसिफिक ऑर्गेनिक लीजन्स है. ओके, एंड इट इज वेरी टिपिकल एंड पर्टिकुलर टू एडवांस्ड सिफिलिस. ऑलराइट, प्लास्टिक आयराइटिस वगैरह ये होता है, उसके लिए we administer that, so that acts dynamically on that lesion itself. all right. Mercury and iodine जो होता है, these substances they act directly as solvents and absorbents. तो यहाँ पे उसका chemical और physiological effect दिखकर आता है. all right, in the treatment, and it's not about the dynamic power. तो ये दो exceptions हो जाते हैं to our rule of the dynamic action of our medicines. Okay. Now that we've understood how medicines act, the next question is how should we apply them in practice? Hughes says over here there are three possible ways of prescribing. Okay, first allopathic, second antipathic, and third is homeopathic. Okay, starting with allopathy first. The first is allopathic prescribing. Here, the medicine acts by exciting a healthy or unaffected part of the body to divert attention from the diseased part. In simple word, it tries to replace one effect with another rather than cure the original disease. ठीक है, और यहाँ पे हम लोग एम्पेरिकली देते हैं विच मीन्स मिक्स एंड मैच काइंड ऑफ. एक मेडिसिन देना है, उसका साइड इफेक्ट कवर करने के लिए दूसरी देना है, दूसरे का साइड इफेक्ट कवर करने के लिए तीसरी देना है. इवेंचुअली इट बिकम्स one dosage becomes a mixture of 3 to 4 medicines together. Okay. Second comes the opposite conditions prescribing, which is antipathic prescribing. They follow the law of opposites. Here we prescribe a medicine that produces the opposite effect of the symptom. For example, giving a sedative for sleeplessness or laxative for constipation. Relief is often immediate, okay, and it's quite desirable as well. But Hughes points out that it is usually temporary and the symptoms return usually in more severity once the power of that medicine weans off. Okay. Third comes similar conditions prescribing, which means homeopathic prescribing based on the law of Similia Similibus Curentur. Here we select a medicine capable of producing symptoms similar to those of patients. Right? According to Hahnemann and Hughes, this is the only method that stimulates the organism to bring about a true and lasting cure. So we have to remember that. कैसे याद रखेंगे? एलोपैथी एक्साइट्स अनदर पार्ट एंड डाइवर्ट्स द अटेंशन फ्रॉम द डिजीज पार्ट. एंटीपैथी opposes the symptom, and homeopathy matches the symptom picture with a similar medicine. The rest of this lecture explains why Hughes considers the third method superior or more appropriate rather than the first two counterparts. Let's now have a look as to why Hahnemann has criticized the allopathic method and not been a big fan of it. Because first of all of us should know that the term allopathy was compiled by Hahnemann himself. Okay, he was the one who gave the modern medicine its name, which is allopathy. Okay, so the word allopathy comes from allo meaning other or different, and pathos meaning suffering of or the disease. ठीक है? In other words, the medicine does not produce effects similar to the disease. Instead, it acts on some other healthy part or function of the body. ठीक है? अभी एग्जांपल देखते हैं अपन एक. In hydrothorax, physicians use diuretics to remove excess fluid through the kidneys. In apoplexy or stroke, purgatives were given to stimulate the bowels. Notice that in both these cases over here, the medicine is not acting on the disease itself. It is simply stimulating the other organ of function in hope that the patient's condition will improve. Okay, Hahnemann's objection was that this method is indirect, uncertain, and often harmful. It disturbs healthy organs and frequently requires large or repeated mixed doses and may create new problems without truly curing the original disease. So now you have already have one original disease A. To cure that off or to treat that off, you are giving medicines B and C. But now you are coming up with some other disease which is disease D, a mixture of A, B, and C together. Okay, as simple as that. That is why over here Hughes is quoting Dr. Paris, who says, if you cannot heal your patient, at least do not hurt him. Okay, this is quite a statement, guys. It's the do no harm principle that we should follow. It reminds us that the treatment should relieve disease without unnecessarily disturbing the rest of the body. According to Hahnemann, this limitation of allopathy paved the way for the search for a more rational therapeutic law, the law of Similia Similibus Curentur. All right. The second law of prescribing, as we saw earlier, was antipathy. ठीक है, अभी antipathic को हम लोग enantiopathic भी बोलते हैं. Antipathic can equate to even the palliative treatment. ठीक है, so the word enantio itself means opposite. So this method is based on the principle of contraria contraris. Opposites are cured by opposites, right? तो यहाँ पे क्या हो रहा है? The physician does not treat the disease itself. Instead, he prescribes a medicine that produces the opposite effect, okay, of the patient's most troublesome symptom. So if the patient has constipation, a purgative is given. If there is a pain, an anesthetic is given. If there is a spasm, a muscle relaxant or a paralyzing agent is given. Drugs like, morphia, atropia, chloroform, nitrite of amyl were all commonly used in this way. Antipathy ke principle pe. Initially, this seems very successful and it's very relaxing as well and very desirable by the patient and the physician too, because the symptoms disappear quickly. However, Hahnemann points out that this relief is only palliative. Palliative matlab temporary. ठीक है? As the drug's action wears off, the body reacts in the opposite direction, and the original symptoms often return with greater intensity. So, this is what he has described as the secondary or the rebound action of the vital force. All right. This graph beautifully explains why Hahnemann rejected the antipathic method. As we see, there's x-axis and there's y-axis. Okay, on the y-axis we have got the symptom severity, and on the x-axis what we have is the time duration. So when an antipathic medicine is given, its primary action is exactly opposite to the symptom. So if there is pain, an analgesic relieves it, right? So if there is sleeplessness, a sedative induces sleep. This is why the graph first shows a sharp fall in the symptom severity. The patient feels much better, but only for a short duration of time. However, this is not the end of the story. As the drug's primary effect fades, the vital force reacts with a secondary or the counteraction. The body tries to restore balance, but in doing so, the original symptom often returns with even greater intensity. This is represented by the steep rise in the graph, the antipathic recoil, or the rebound effect. Hahnemann repeatedly observed this phenomena in practice. He concluded that medicines acting by opposites provide palliation and not cure. They suppress symptoms for a while, but the disease eventually returns, often in a more severe form. That is why homeopathy does not aim for temporary suppression. Instead, it uses a medicine producing similar symptoms, allowing the disease to be cured rather than merely silenced. ठीक है? Now we come to the third law, the universal law of therapeutics, which is the homeopathic method based on Similia Similibus Curentur. लेट लाइक्स बी क्योर्ड बाय लाइक्स. ठीक है, अभी यहाँ पे ना एक बहुत सिंपल सी एनालॉजी यूज की गई है, बट इट्स क्वाइट एन इफेक्टिव वन. ऑलराइट, सी ऑन द लेफ्ट एंड द राइट. फर्स्ट द लेफ्ट साइड. ओके, इमेजिन अ डोर दैट इज लॉक्ड. वन वे टू ओपन इट इज एक क्रोबार लो. यू नो व्हाट इज क्रोबार? जो हम लोग लॉक्स तोड़ते हैं ना जिससे, वो. ठीक है, एंड विल स्मैश इट ओपन. The door may eventually open, but in the process you damage the lock, the door, and even the surrounding wall, right? Hahnemann compared this to the allopathic and the antipathic method. They often achieve their objective by using powerful physiological actions or large doses. सही है? Symptoms may be relieved, but healthy tissues may also be disturbed. Adverse effects may occur, and in antipathic treatment, the patient may even experience the rebound phenomena. Okay, as we have discussed in the previous slide. Now, see the image on your right side of the slide. Instead of breaking the lock, imagine finding the correct key. The key fits perfectly into the lock, opens the door smoothly, and causes no damage at all. ठीक है, दरवाजा भी खुल गया और कोई डैमेज भी नहीं हुआ. So this is Hahnemann's idea of homeopathy. A homeopathic medicine is selected because it's capable of producing a symptom picture similar to that of the patient. Since it matches the disease state, it acts specifically on the affected vital disturbance, gently stimulating the organism to restore health while leaving the healthy parts undisturbed. This is why, guys, Hahnemann believed that homeopathy works more naturally than merely suppressing symptoms. As Dr. Drisdale has stated, and it is quoted over here, that the physiological action is absorbed into the therapeutic. In other words, this means that the drug's ability to produce symptoms becomes the very reason it can cure the similar symptoms. ध्यान से सुनो, the drug's ability to produce symptoms becomes the very reason it can cure similar symptoms. ठीक है, most importantly, because homeopathy, is not working by producing opposite effect, it avoids the antipathic recoil or the antipathic rebound. Instead of temporary palliation followed by aggravation, the aim we have is the gentle, permanent, and complete restoration of health, right? Now that we've discussed homeopathic method theoretically, let us look at some interesting clinical observations now, okay, that even conventional physicians have reported. So these examples are important because they demonstrate a very fascinating principles. और वो क्या है? That reducing the dose of the drug can sometimes reverse its clinical effect. Now, these observations, they do not prove homeopathy by themselves, but they support Hahnemann's idea, okay, that dose matters and that a medicine may behave differently in minute quantities than in crude doses. ठीक है, तो सबसे पहला हम लोग लेंगे डॉक्टर रिंगर का, which was of amyl nitrite. So amyl nitrite, it's a well known as a powerful vasodilator. ठीक है, in large doses it dilates blood vessels rapidly, producing intense flushing of the face, warmth, throbbing headache, and palpitations. However, Dr. Ringer observed something remarkable. As he progressively reduced the dose even to an extremely minute quantity, about 1/30th of a minim, Okay, 1/30th of a minimum, a very minute dose. The same drug helped to relieve abnormal flushing instead of producing it. Okay? In other words, the medicine that causes flushing in large doses appeared to counteract flushing when administered in minute doses, and it did so without the unpleasant effects seen with larger dose. So this is an example of what Hughes calls a clinical reversal. Okay, the therapeutic action appears opposite to what we expect from the crude physiological action. ठीक है. Second हम लोग एक एग्जांपल और देखेंगे which is by Dr. Murrell. Okay, and he talks about Drosera over here for spasmodic cough. Drosera drug proving produces irritation of the respiratory tract and violent spasmodic coughing. Yet, when administered in minute doses, it successfully relieved patients suffering from this type of spasmodic cough. Again, this beautifully illustrates people the principle of Similia Similibus Curentur. Third example we will see, that is of Sir L. Brunton. Okay, he is talking about treating constipation using minute doses of opium. Normally in crude doses क्या होता है, opium is notorious for causing constipation by reducing intestinal motility. Yet, Brunton observed that in minute doses, it could actually help restore bowel function in certain patients with constipation. So, this paradox again suggested that simply knowing the crude physiological effect of a drug does not always predict its action when given in एक्सट्रीमली स्मॉल क्वांटिटीज. ठीक है, तो अभी ये एग्जांपल्स का इंपॉर्टेंस क्या हुआ, हम ये डिस्कस क्यों कर रहे हैं, ये हम इसीलिए डिस्कस कर रहे हैं बिकॉज ह्यूजेस इंक्लूडेड देम टू शो दैट सेवरल रिस्पेक्टेड फिजिशियंस observed phenomena that could not fully be explained by ordinary pharmacology alone. Their experiences suggested that minute dosage may alter the qualitative action of a drug, and this concept is entirely compatible with Hahnemann's doctrine of homeopathy. Right? So, these clinical reversals formed part of the historic evidence that has encouraged physicians to seriously consider the therapeutic potential of minute doses and the law of similars. अब तक हमने देखा है the advantages of minute doses, right? अब we are going to shift our attention to the opposite extreme, और वो क्या है, the tragic consequences of overdosing. Hughes cites examples from the Cyclopedia of Drug Pathogenesis to remind us why Hahnemann strongly opposed the indiscriminate use of massive drug doses. The case of Sidney Dobell. Okay, the first example is a tragic story of Sidney Dobell, an English poet. So Dobell suffered from illness and was repeatedly treated with morphia, chloral, and potassium bromide drugs that were commonly used as sedatives during that period. Initially, these medicines relieved his symptoms like it should. Morphia reduced the pain, chloral induced sleep, and bromides calmed the nervous system. But because they were used repeatedly and in excessive amounts, they led to dependence, mental dullness, and progressive deterioration. Hughes describes this by saying a noble life poisoned and a brain fettered by fashionable sedatives. अब देखो ये quotes और ये statements ऐसे आ जाते हैं ना in philosophy, it becomes important to know them. Who said to whom? Yes, you should know that because that is the philosophy that you're studying. Okay, so the message over here that Hughes gives is clear. Medicines that provide temporary relief can become destructive when used recklessly or habitually in large doses. ठीक है, ये सारे habit forming drugs है. Over a period of time you take them, then that function cannot be performed unless you're taking it them. So it's a never ending cycle that you will encounter. Okay, other examples may on the right side that you can see. One is the excessive use of arsenic for treating pemphigus. What is pemphigus? It's a severe blistering skin disease. ठीक है? And although arsenic was considered beneficial, excessive administration often resulted in toxic effects, sometimes causing more harm than the disease itself. Patient arsenic poisoning में चला जा रहा है after using it so much for that particular blister on the skin. Okay, अभी एक दूसरा एग्जांपल है आयोडीन का, often combined with potassium iodide, which was extensively used for cancer and other chronic diseases. Physicians of that era, okay, frequently prescribed these drugs in large quantities, believing that stronger doses produce stronger effects. Unfortunately, many patients suffered from iodine poisoning, digestive disturbances, weight loss, glandular damage, and other adverse effects. So यहाँ पे हम क्या सीख रहे हैं इससे? Then Hughes is not criticizing the drug themselves. Even every medicine has therapeutic value when used appropriately. ये याद रखना है. We are not sitting here to degrade or to criticize only the other therapeutic methods which are existent then and now. ठीक है, बट अगर हम अप्रोप्रिएट उसको यूज नहीं करें, इवन होम्योपैथी फॉर दैट मैटर ना गाइस, इफ यू आर नॉट यूजिंग इट इन द वे इट इज सपोज टू बी, ओके, जो उसका सेट रूल है, सेट फॉर्मेट है, अब वो छोड़ के आप भी अपने पेशेंट को अगर ओवर ड्रग कर रहे हो, देन यू आर डूइंग इट रॉन्ग. Okay, so criticism was directed towards the reckless philosophy of overdosing that dominated the 19th century medicine. Physicians often believed that if a little medicine was good, more medicine would be even better. But Hahnemann has completely rejected this idea. For Hahnemann, the right therapeutic effect was with the least possible harm. सही है? So with this we proceed to the next slide. अब यहाँ पे हम लोग हैनेमन का स्ट्रॉन्गेस्ट आर्ग्यूमेंट रीइंफोर्स करेंगे, which has been that every medicine has a definite power to produce its own characteristic disease picture known as drug pathogenesis. If drugs can produce symptoms in healthy individuals, then indiscriminate or excessive use can also produce severe noxious effects in patients. ठीक है, let's see the examples over here. First is quinine. Quinine was widely used for fever and malaria. However, physicians observed that its excessive or prolonged use could damage the inner ear, leading to labyrinthine deafness, severe tinnitus, hearing impairment. ठीक है, this tells us that medicines are not harmless. They have their own characteristic toxic effects. Side effects पढ़ रहे हैं हम लोग ये सारी चीजों का यहाँ पे. Second, we'll talk about antipyrin. It was commonly prescribed to reduce fever during influenza. Later observations showed that its indiscriminate use could actually worsen the patient's condition and in some cases increase the mortality. ठीक है, थर्ड हम देख रहे हैं एंटीसेप्सिस पॉइजन्स का, सच एज कार्बोलिक एसिड्स, corrosive sublimate. ये chemicals were extensively used as antiseptics, but they could be absorbed through the tissues and produce systemic poisoning. ओके, तो मेन बात हम लोग यहाँ पे क्या दे रहे हैं, इसी विच इज इवन स्पोकन विद स्प्रेंगल एंड हैनेमन. ठीक है, ये दोनों का भी जो कहना है is that the medicines given in homeopathic practice display that potent kind of action as specific. Okay, mode of action is drug proving when disease is only not known. इसका मतलब क्या है कि drug toxicity and drug proving are two sides of the same coin. In toxicity, the symptoms are unwanted and uncontrolled. And in proving, the same drug action is observed carefully, systematically, and safely, providing the foundation for a rational remedy selection. Now, we are going to trace the historical search for what physicians called as a specific medicine. Okay, a remedy that acts specifically against a particular disease. So the journey begins with early empiricists, okay, like Sydenham, Bacon, Boyle. They believed that careful observation and experience could identify such specific remedies. A classic example was cinchona bark or quinine, which proved remarkably effective against ague or malaria. This was one of medicine's earliest examples of empirical success. Next comes Flint. who made an important observation that he suggested that medicines capable of producing similar symptoms to a disease might actually help discover these specific remedies. This idea brought medical thought closer to Hahnemann's principle of similia similibus curentur. Later, with the rise of modern bacteriology, attention shifted towards destroying the microorganisms. However, physicians also realized that simply eliminating the bacteria did not explain everything. For example, fever may be a part of the body's natural defense rather than merely something that should needed to be suppressed. But अभी भी हमको fever होता है तो हम क्या लेते हैं डोलो. Why? Because it suppresses that fever off. But the body is saying कि भाई मैं fever इसीलिए आ रहा है so that internally that infection or whatever is present inside is being correctly fought by your body itself. ठीक है. Finally, an editorial in the Lancet in 1895 admitted that understanding exactly why a medicine works and identifying a true specific remedy still belonged largely to the realm of pure art. ठीक है. Pure art क्यों है? Is throughout medical history, physicians searched for specific medicines. Hahnemann believed that most reliable way was to find it through drug proving and selecting the medicine which closely resembles the patient's symptom picture, and thus the principle of similia similibus curentur. We have now reached the conclusion of Hughes, okay, on the discussion of this chapter. After explaining the theoretical basis, Hughes ends by asking an important question. Does homeopathy also have clinical evidence? Okay, जो अभी भी वो चल ही रहा है क्योंकि हम डॉक्यूमेंटेड इतने ज्यादा क्लियरली नहीं है. We fail to document our progress, we fail to document our success. So that question, evidence based medicine, are we an evidence based medicine? According to Hughes, the answer is yes, and he has presented several historical examples as you can see on your screen. ठीक है. These examples, they mention the institutional comparisons along with the comparisons which are presented as additional examples ki where homeopathic institutions reported enough and encouraging outcomes. Okay, we all can read it for ourselves over here. There's nothing much to explain about the institution, where it is, why it is. Okay, but the final message that we have to understand, the synthesis part of it, is Hahnemann's method acts silently, peacefully, and without violent evacuations or harsh physiological disturbances. Unlike the older methods that relied on purging, bleeding, or massive drug doses, homeopathy aimed to stimulate healing gently. Okay, Dr. George Wood summarized this beautifully by saying that the success of homeopathy lies not in the crude drug action or antipathic suppression, but in the selective affinity of the specific remedy. That is the medicine whose proving symptoms most closely resemble the patient's disease. Okay? So, to summarize this entire lecture, what we have to remember is drug possesses a specific pathogenetic action. The correct remedy is selected through law of similars. It is to be administered in the minimum effective dosage, and the goal is gentle, rapid, and permanent restoration of health. This is the philosophy that Hughes presents in support of Similia Similibus Curentur, and it forms one of the fundamental principles of classical homeopathy. All right. Now we have our exclusive handout that is made for your quick reference, covering the entire chapter at one glance. It is also available on our Instagram handle at the Organon Classroom. If you find this lecture relatable and useful, please do like, share, and subscribe to the channel, the Organon Classroom with Dr. Gazala. Coming up next is our next logical step, which is selection of remedy. So, episode 6 for Hughes series is going to be lecture 7 of the Hughes textbook, Selection of Remedy. Okay, here we are going to discuss how Hahnemann is going to transform the principle of similia into practical bedside prescribing. Until then, study well, have fun. Thank you so much.